I wanted to introduce her as first, she's certified in, diplomate in avian medicine, which is great. But she's also worked in a practice, so she has that full experience of working with clients, surgery, etc. She also works with a lab, so she is an expert at lab work and how important it is and interpreting it, etc. And now she works with Harrison's and food company nutrition issues. So she's got this wide gamut of experience and knowledge, and we could not be more grateful to you, Dr. Murphy, for being back with us today. So I'm going to go. Oh, let me just remind everybody, as I should have from the start, as most of you know from being with us in the past, if you have questions for her specifically, put those in the Q&A and we'll do our best to get to them at the end. And please remember not to ask her to solve your bird's problem. That's not what we're here to do today. So try to pose your questions in a generic way that benefit everybody. And if you just want to chat amongst yourselves, go to the chat, introduce yourself, have a discussion. That's great. We encourage you to do that. So I'm going to go offline, turn it over to Dr. Murphy. And again, very grateful. And I'll see you all at the end.
Wonderful. Good morning, good afternoon, hello. It's so wonderful to be here, and I'm excited to talk about this topic because, oh man, I like beaks. Beaks are cool. Not only are they neat because they vary so much from species to species, but from a medical perspective, I really learn a lot from my observations and evaluations of the beaks of my patients. And so I'm excited to transfer that knowledge to you guys so that you are able to make these observations in your own animal and be able to help improve your health evaluations even at home. So, all right, I'm going to get started. All right, well, we know we're talking about beaks, so I had to put the most epic beak on here, right? The toucan. But we're going to focus mainly on parrots. So the first thing that I want to talk about in regards to beaks is how we use them as a part of our health assessment. Keeping an eye on your bird's health, right? So there are 5 components that I use at all times when I'm making a general health assessment of a patient. And this is not, necessarily hands-on physical exam. It's more of a general visual exam, right? With some types of palpation things. So, we look at each of these different components in and of themselves, and they're informative, but it's when you take all of this information together. So it's the combined assessment of these parameters that really help us get an initial understanding of our patient or our own bird's health, right? So the first component that I want to discuss with you guys is muscle condition. Muscle condition is how well developed the pectoral muscles are in the bird. And as you can see, there is this really nice grading scale that compares the prominence of the keel to the development of the pectoral musculature and grades it from a 1 to 5. Now, this is a general assessment, and this is something that I teach all of my clients to do at home with their birds. So they come in and we do their exam, and I say, hey, your kid's got great muscle. Feel this, right? And I go, feel for that keel, that breastbone coming down the middle, and then feel the pectoral muscles on either side. And if you feel this nice U shape, right, you're doing great. If you're feeling it, and it's not a perfect U, but it's close, you're doing pretty good as well, right? You have a bodybuilder here if you got a 5 out of 5. And there's some species like African grays where this is going to be normal, right? It's when you start to go, well, my bird has always been a 3 out of 5, but now I feel like what used to be a U is now a V. Or even worse, there's hardly any pectoral musculature at all. And so I use this example of Pickle because Pickle decided to not wear his shirt or his pants really today. And you can see that just visually, the keel coming right down the center here and the pectoral muscle mass, oops, excuse me, is really nice, that nice U shape. Now, species like I was mentioning about the African gray, they're going to have a little bit of a different subset of normal. So if I have an African gray that I'm thinking is a 3 out of 5, I want to know why, right? That's a little bit less normal for that species. Flight capabilities. You can imagine that the pectoral muscles have a huge, they play a huge part in, you know, the activity in flight, right? And so if you're not flying a whole bunch, your pecs are not going to be as developed. And there's different reasons for why you may not be flying. You may be scared, you may have a previous injury, you may only have one wing, right? In which case there could be some asymmetry. But the idea is that in health, you realize what is normal for this individual, and then use the scale to go up and down and evaluate it, right? So this is one thing. Then you think about the numeric weight. The numeric weight is great as long as you measure it at the same time for the most part every day, because if you're measuring it before a meal one day and then after a meal another, you're going to have huge fluctuations, right? So weight is nice, but then when you put that together with muscle condition, let's say the weight is the same, right, on the scale, 92 grams in this case, but you have less muscle mass. Well, where is that new weight going, right? Where is that weight shift? And that's going to allow you to say, ooh, there's something more to this story. You're going to hear my bird in the background, so please excuse her. She may actually fly over. So the next thing that we look at is the feathers. The feather quality and the frequency of molt is a very important thing. Visually here, right off the bat, you can see that this green Amazon is not as green as it should be, right? And so in this case, older feathers are going to create a change in the perceived color that we see. And this can absolutely be evidence of disease. You go, could there be changes in the ability to create the pigment that supports this green coloration? Is it older feathers that have been there for so long that now their normal architecture and the refraction of light based on that architecture is abnormal, and so now we're seeing a different color because it refracts light differently? Or has there been something placed on these feathers that shouldn't be, right? You put a whole bunch of medication on your hand and then you think it's fine, but you pet your bird. I've seen that happen a couple of times. So ultimately, these observations are very important. Old feathers also play into frequency of molt. So when I see these sorts of black things and everything else seems fine, I go, when was the last time your bird molted? Then you start to ask, well, is it because, you know, the right type of bathing environment has not been offered, or maybe no bathing environment at all, or something has changed in their husbandry practices? Or is it because they don't feel good and they're not doing what they're supposed to? So ultimately, these two things can be very important. And the last thing is the appearance of the beak, right? And that's what the rest of this talk is going to be about. Because just like all of these other external factors that we have discussed, the beak is almost like somebody, you know, like I like to compare it to this. If you're feeling good every day, you're going to wake up, you're going to do your hair, you're going to brush your teeth, you're going to have a good breakfast, maybe a late breakfast, who knows? But you're going to engage in these normal and grooming activities, right? With birds, if they feel good, they're going to engage in those normal grooming activities as well. And ultimately, when they're not feeling well, they're not going to engage in that, and they may have abnormalities of their beak keratin, right? So moving forward, we're going to talk about, please give me one moment. I'm so sorry. Ava has a lot to say this morning, and I need to just, I need to give her something to do. Hold on a moment. She's going to do what she wants, it seems. So let's talk about the beak some more. Okay, So the anatomy and physiology of the beak is very interesting because although we discuss it as a single entity, it's made up of so many, it's influenced by so many different organ systems in the body that it is actually, very complex. Now, as we can see here in this picture, this is a cross section of the beak. And so we're seeing on the inside, you can see where it's labeled C. This is where the airspace will be. And you can also see the labels for B and A, and how although both of them are keratin, how the keratin appearance is different. It's very thin up here, thicker as it gets down towards the end. And then finally, we've got this corrugated appearance to the inside of the upper bill. So it's very, very interesting how those changes come into play. So as we discussed, the organ systems of the beak are many. You have the integumentary system, and that is referencing specifically the keratin or the outside of the beak that we are regularly engaging with, right? And this is a cool picture because in younger birds, the keratin is softer, and specifically in this area here. So I always thought that that's just the coolest thing. I love the feel. It's almost velvety in that area. And of course, as these guys age, they grow out of it. But something that I always thought was very neat. The nervous system is awesome. So there are two aspects of the nervous system that are involved in the beak. Of course, you have these huge cranial nerves that come in and they innervate the muscles and everything to open and close the bill. But the other thing that you have is that you have different nerve receptors for pressure, for touch, for all types of very, very fine sensations. And, you know, it's sweet because when you understand this, what happens next is you're petting your bird's beak, right? And they're loving it. And you go, oh my gosh, I know why. The next thing you look at is the vasculature. They're highly vascular. It's a highly vascular organ, right? So you've got the keratin on the outer part. And then on the inside part, just underneath the keratin, you have a dermal layer that contains all of these nerves. Well, that dermal layer also contains all of the vasculature to that tissue as well. And this is really neat. You can see how the veins just course all through not only the beak here, but the neck and the head. I just love this picture. When you look at the skeletal system, it's quite complex. There's multiple joints that are involved in the movement of the beak. And if any of you guys have watched your bird, and I'm going to show you a slow motion photo, slow motion video soon. If any of you guys have watched your bird, you'll see that not only does the beak open and close, but the upper bill hinges and the lower bill moves forward and back. And it's all because of all of these different bones and how they articulate and move in concert with each other. So you can imagine that, let's say you have an injury. I'm going to pause this just here. Let's say you have an injury to this bone here. That's going to greatly affect the bird's ability to open and close the beak as it should. This is really neat. The respiratory component of the beak. So this component here shows us, so this is a CT of the bird's head, and it's looking at things from the side. Everything that is gas-filled is black. So the outside world is black, but then you can imagine that a sinus would be black as well. And so you have all of these air-filled structures, not only in the beak itself, but around within the head, underneath the eye. We can't really see eye would be here, right? So you've got your beak, this little tongue. I always like to see that. It's kind of a silly thing, but I do. The brain, and then you've got the part of the vertebrae here. So we're looking at all of these different organ systems. Now, this is also really cool. We talk about the musculature, right? So you, with all of the bones and joints and things like that in the head, you have to have muscles to move them. And I know these are a little grotesque, but does a very good job showing the different regions of the muscle that are responsible for helping move the beak as we see it. And here's that bone that courses just under the eye that we're talking about. Like, you can imagine, my gosh, if this was broken, how that could affect the movement of the beak. So here's my favorite video in the world. This is my bird Ava. And one day I was watching her just, do her little chin scratches. And I caught the way her beak moved in slow motion. So you can see the independent movement of the lower bill. And you can also see how the upper bill independently moves as well. And then, of course, they open and close and all those sorts of things. So it's really incredible how all of those structures make this happen. Now, we have a brief overview of how the beak is essentially what it's made up of, right? So now that we have this foundation, we can go into assessing it, right? So what are the things that we look for to tell us, hey, this beak is abnormal? And some of these things are probably intuitive, right? Does it smell funny? Like, if your beak is smelling funny, you got a problem. So that shouldn't happen. Is the keratin uniform, right? So there's normal growth of keratin from right under the region of the sphere down. And you're going to see some flaking like that. But ultimately, you shouldn't see big, thick pieces. How does the lower and the upper bill fit within each other? Do they fit evenly? Is the occlusion appropriate? And some of the most significant issues with beaks are issues with occlusion. And then the last thing is strength. So you can have a bird who may have a seemingly normal occlusion. The keratin seems okay, maybe a little bit off. And you're going, no, this bird seems fine. Why is the keratin off? And you start speaking with the owner, or you start speaking with your friend, whoever it is that you're talking about this with. And you go, well, is the strength of their beak normal? And that's a very important component, because if your strength is abnormal, it indicates that maybe there's something going on with your muscles here, or maybe there's trauma to the bone that changes how you're able to put pressure down on an object. So these are some of the big things that I think about and I look for right away. So we're going to go through a bunch of cases, because I think this is the best way to, well, I think it's the most fun and the best way to teach. All right, so this is cool. So Bob is a bird that I saw when I was in my residency, and he was 8 months old at the time that he presented. This is a real picture of Bob and a picture of his issue. And as you guys can clearly see, he's got lateral deviation of, we're gonna use the scientific terms here. So we have lateral deviation of the distal rhinotheca. And what that means is the upper beak is tilted to the left. So this bird has a scissor beak, but specifically, it's this lower portion of keratin that's deviated, and that's the distal rhinotheca. Okay, and you're going to see I'm going to pepper in some of these anatomic terms so that when you are reading things or when you're referring to an area, you can go, oh yeah, I know what that's actually anatomically called. And then people who you're talking to, if they know those terminologies, they'll be able to know exactly what you're talking about. So in a young bird, and I use a macaw's example, but this can happen in any species. Scissor beak malformations or malocclusions can occur for a variety of reasons. Sometimes we find out why, like, oh, I know there was trauma in the nest. But other times we don't. Could there be a congenital malformation where one of the bones is shorter than the other, changing the way that the pressures of the muscles, changing the way the pressures from those muscles are applied to a food item, and ultimately, if you have one strong muscle on this side, because it's pulling up, and it's going to pull things over, and this side is going to be weaker. So it's only going to get worse and worse and worse, right? So in this case, it's unique because he's young and his growth plates are not completely closed. He's right at the cusp at 8 months, right? But his growth plates aren't completely closed. So what you can do for these guys is you can do transsinus pinning. And you can put this pin through the sinus that's right behind the nares. And you can use it to create tension on that lower portion of the keratin. And what this does is it forces the musculature, it forces things in the right place, and it forces the musculature to grow and to develop in the right way, in an even way. So that when all this comes out, he's grown, his bones have developed in the right direction, his muscles have developed properly, and now he's able to keep things with proper occlusion. And ultimately, for Bob, because he was on the older end of the scale, we didn't get a perfect resolution, but we got a really nice improvement. And we knew that we would be on the cusp. We were hoping for perfection, but he really did benefit from going through this. And ultimately, when you do this, you're on lots of good pain meds and all that sorts of stuff too. So we're not going to talk about the therapeutics involved, but that is an important component of this. Now, in birds who are older, their growth plates have already, they've already calcified. And so with those types of birds, if you're encountering a scissor beak malformation or a scissor beak malocclusion, excuse me, there are specific ways that you can trim the beak dependent on where that malocclusion is coming from. And you can actually create a physical therapy environment, right? Where you come in, you've got your beak all to one side. We know that the side that the bill is moving towards is going to have more muscle development on that side. And it's going to be stretched on this side. So what do? You take the lower bill and that cutting edge and you tilt it. And you make that weaker side be the one where all the pressure gets put on. And now you're working out this muscle harder than this one, working for an even situation. So that's part of one of the ways that you can help with scissor beak malformation. Now, if it is just something that's been acquired and there's no associated trauma, things like that, you can get full resolution. But what if you have these muscular changes, but there was trauma that occurred to maybe that jugal bone? And in those cases, you may not have as much resolution. So every single beak is different. And you have to look at things generally and then tailor those observations to the individual in front of you. What's interesting about the bird who may have the trauma, right, is they may not be able to crunch a seed as hard, or maybe they used to just rip through pine and now they can barely rip through balsa. That's something. And so we go back to that strength, that, how do you assess for strength? Why do I assess for strength? It gives me an idea of what could be going on further inside, something that I may not be able to see. Now, of course, advanced imaging like the CT can tell you those answers. Some people will choose to do that because I just want to know and set my expectations appropriately for what resolution can be achieved. But anyway, we're going to go on to the next case because, as you can tell, I love talking about beaks, so I can do it forever, and we're never going to get through all of these. So our next friend is Susie. I saw Susie my first year out of vet school, and she's really cool. I really love this bird. You can tell that this is an older picture at this point. It had a good detail back when I took it. But Susie is a female green-winged macaw, and she was adopted by a rescue. Well, I guess taken on by a rescue, and then ultimately went into a new foster home. And she had this very frustrating lesion on her beak here. So the new owner came in and goes, I just want to get a second opinion, what's going on with this beak. And you see this large red raised lesion here. And she goes, and you know what? She has this cough. And Susie comes in and she's full of spit and vinegar. And immediately I loved her. And she looks at me and she goes, And I go, oh man, was Susie's old owner possibly a smoker? And they go, yeah, she was. And so this cough was nothing more than her mimicking her old owner's cough. Um, she clinically was okay, but her main problem was this abnormality here in her beak. And there's a lot of different reasons why this can occur, right? Could she have had trauma and this is how it healed? Is there a deeper infection? Could there be cancer under there somewhere? And nothing had been done to necessarily dig into this and get a definitive diagnosis. So it was decided that we would do that. And the way we investigated this is we put her under anesthesia and we took a deep biopsy of this area. So not just a superficial, but like a really good chunk, because I wanted to know what was in there. Biopsy confirmed that this was cancer, and it explained a lot. And ultimately, this type of cancer that she had, it's not going to get better. There's nothing that we can do to necessarily make it go away. Sometimes options like radiation can be considered, but we just decided, collectively that we would do as much as we could for Susie to keep her as comfortable as possible for as long as possible. But one of the things that I wanted to bring up, and this is a great example of, is that where keratin develops is in a specific layer of the beak that's right adjacent to the cers, right? I'm pretending I'm a bird, but right underneath the nose folds, where the keratin of the beak and the normal skin connect, is where all of the cells that regenerate the keratin are located. So if you have trauma or an abnormality to that area, your expectations for regrowth and return to complete normalcy need to be augmented. It's hard to predict perfectly what could happen, but for Susie, what we talked about is that, if this was an infection that we could find a resolution to, I was very skeptical that she would ever have normal keratin grow again in this area. It would grow around it, right? But not through this region because of the damage to that essential germinal layer. All right, so then there's James. And James is a perfect example of this case. So James came in for his annual exam, and he weighed 42 grams and his normal weight was 32 grams. Okay, so James gained 10 full grams, which is a lot for this little guy. And on his physical exam, of course, we can all appreciate the elongation of his upper bill, right? And one of those terms that we used before, the rhinothecaltomia, right? The rhinotheca is the reference to the keratin of the upper bill, and the tomia is the cutting edge, right? So there's elongation of that specific region of the beak. But also within the keratin, there are some abnormalities. So you can see that there's this discoloration here that essentially is like a bruise. But you can also see these striations and that same discoloration within those striations as well. And that's actually very, very important, because if you're seeing this quick elongation of keratin, abnormal appearance to it, and these bruises, subkeratin bruises, what you start to go is, could there be something going on with this bird's liver? You pair the beak observation with your physical exam, and maybe just the fact that he gained 10 grams, and you say, hey man, you got a lot of fat pads all around your body. You've gained a lot of weight, and your beak is telling me that your liver is affected as well. So based on his physical exam and all of the information we obtained at that time, we made a presumptive diagnosis of fatty liver disease, or hepatic lipidosis is another term for it. So what's important about this and how it affects the beak is that the liver plays a huge role in keratin health, and it plays a role in the body's ability to clot, right? So tiny little things that affect the beak that otherwise wouldn't make any difference in the world are causing it to bruise because the clotting ability is not ideal. Now, I say working diagnosis or presumptive diagnosis because per the textbook, or per perfect medicine, or perfect logic, not necessarily medicine, To confirm a diagnosis, you would do liver biopsy. Maybe you would get some blood, you do some blood work, look for some liver function indicators. But you know what I don't do? I don't pull blood or do procedures on people, or excuse me, on birds who can't clot, and I'm sure y'all wouldn't either. And so the best way to address these things is to say, hey, let's keep a close eye on him. Let's help him with a weight loss plan. Let's rebalance his diet, get him down. And over the course of 6 to 8 months, let's keep in touch and let's make sure that we're going in the right direction. Ultimately, with weight loss and rebalancing the diet, fatty liver disease will resolve. And as such, the keratin will return to normal and it will no longer have these abnormal discolorations within it. At this time, we did trim his beak to a more normal length, right? And you see my mouse because I go, this is where we would trim it to, right? So that way he could eat comfortably and whatnot. And so I saw him every 3 months, checked the length of his beak, saw how he was doing, watched his weight loss, and ultimately he did great. By the end of 8 months, we got some blood safely, right? And checked our work. Hey, you look good, you feel good. How is your liver functioning? His liver was functioning excellently. And we said, all right, let's not do that again. Let's not gain all that weight again. Let's stay on a good, healthy diet for the rest of your life. And ultimately, James continued to do well. So this is a really nice case and something that not only budgies can deal with, but every single parrot species and even past parrots, we know chickens can deal with this as well. So I really like these cases because they have a great outcome usually. All right, so Pickle, this is cool because you guys saw a picture of excuse me, that's a tongue tie. A picture of Pickle in the beginning of our lecture. And that was when Pickle was feeling great. Well, this was the day that Pickle presented to me. And I hope that you guys are looking at this picture going, I see all these abnormalities just visually. We don't even have to do an exam. And so what we can see is a variety of things. We can see that the beak is abnormal. We can see that his keel is quite prominent. It's a little bit on the thin side. And then we also can appreciate that he's got this distended belly or distended ceiling. And we're on, what's going on there? Why is your belly like this? Also, and we can't find a peer-reviewed paper on this, right? But I think all of us know as bird owners or bird lovers, bird caretakers, whatever our role is in the health of their birds, that there's something about their eyes that change when they don't feel them. And you can see that change in Pickle. He just feels like poo. Also, his feathers are poorly groomed. He wasn't wearing a shirt today either, so we're not going to judge him. But ultimately, we go, all right, well, your beak doesn't look so great. Let's actually, here we go. We can zoom in on that. We can see that the keratin is, we've got this thick keratin overgrowth here. His beak is closed, and there's a wide space between these two regions. That space is there and is abnormal because this lower end, excuse me, I'm trying to use normal words and I'm only thinking of my big words. So the rhinotheca is the keratin of the upper bill. The gnathotheca is the keratin of the lower bill. And as we discussed, the cutting edge is referred to as the tomium. So here, the gnathothecal tomium, or the cutting edge of the lower bill, is very elongated, and it's resulting in this excess space here. We can also see that the cutting edge of the upper bill, the rhinothecal tomium, is not only elongated, but significantly thickened. It's long on the sides, and so this is really abnormal. But this isn't his primary problem. He is not doing what he's supposed to, because in fact, he had significant liver disease. His liver disease was so bad that he was not able to regulate his body fluids in the right way, and excess body fluids was depositing in his belly. And so he had not only liver disease, but he also had ascites. So that's what that collection of fluid in the belly is referred to. And so what's nice about having that fluid is we could do an ultrasound and we could say, hey, is there a target here within the liver that we can biopsy where we think that we can get a diagnosis? And in fact, there was. His liver was supremely abnormal in all of these cystic regions. So we placed him under anesthesia and we got a liver biopsy. And what we learned is that this wasn't an infectious cause, there wasn't any cancer, but in fact, he had hepatic fibrosis, which is a scarring of the liver. In some cases, you can find out why that's occurred, but in others, all you can diagnose is the end effect of whatever caused it, right? So with hepatic fibrosis or liver scarring, right, there are certain supportive medications that you can provide, and then the liver has time, it has some extra help, and sometimes it can sort of regenerate in a way, it can heal. And ultimately, over 2 years' time, he was on these liver supportive medications. The ascites never returned. As you can see here, he's bright-eyed and bushy-tailed. He's got this beautiful muscle mass. Even the appearance of his skin looks better. He doesn't have that poochy belly that he had in the past. And we were able to safely start to help adjust his beak to a more normal contour for his species. And it was great. Pickle is so cool. He's still with us. He's on no medications. He's had no relapses. His liver ultrasounds are back to normal. And I would say he got the best case scenario of his presentation that he could. And so it's really sweet. You know, his owner has a special Instagram for him. And so I get those updates and I see him jumping around, you know, as kikes do. So, and I'm always watching because his feathers, you know, he damaged these so long ago that they're not going to come back. And so I can always watch his muscle mass from his Instagram posts. So I want to make sure he's okay. All right, so Kermit's a cool case because this brings into account some of the important things that we talked about regarding the layers of the beak and the innervation. So this is a 1.5-year-old presumed female, but because there's no ring, but ring-necked parakeet. And Kermit presented for a history of not eating for 3 days. And 3 days ago, what happened was the cage mate bit Kermit in the face or in the beak and resulted in this injury that you see here. And you can see how you've got this like weird kind of like thickened tissue. The keratin of this upper bill is all irregular and missing. Whoop, oh, no. And ultimately, the owner goes, I didn't think it was a problem because there was very little bleeding. And I was like, that is like, that's reasonable, right? I mean, like, yeah, you have some damage here, but I don't know, can you really understand the severity of what you're seeing if you don't understand the anatomy of the beak? So I said, well, is it that, you know, I need to understand if this bird is not interested in eating because he feels poorly, or if he can't eat because he hurts, right? So I took his favorite food, the sunflower seed, and in a normal circumstance, he should be able to take care of that, no problem. And he picked it up, and he was really, real ginger with it, and then he dropped it. And I said, hey man, you are uncomfortable. You don't want to eat. You can't eat because it hurts. It's not that you don't want the food. And so ultimately, putting him on pain medication was a huge part of his support. And the reason why this is relevant, and I hope you guys are going, oh yeah, because that dermal layer has nerve endings in it, and they're highly sensitive nerve endings. And right now, all of those nerve endings are super exposed. And so what we did is in the exam room, we gave him an injection of butorphanol, which is the preferred opioid for parrots. And it's the best one injectably that we have at the moment. We also gave him an injection of meloxicam to essentially prime the pump. That way he can get the benefits of that anti-inflammatory within 15-20 minutes rather than waiting longer for oral absorption. And we said, all right, hang out here for about 30 minutes, after which we're going to give you some more food. I want to see what you do with it, because I really wanted to make sure that he was comfortable and able to eat before he left. And sure enough, 30 minutes later, we come in with those same sunflower seeds, and he cracks them and he eats them and he feels great. And you go, all right, so let's switch you to some oral meloxicam, oral tramadol, good oral opioids, or oral pain medications. Meloxicam is an anti-inflammatory, tramadol is an opioid. And this guy did great. He healed. He was able to become less comfortable, be off meds within about a month's time. We kind of titrated things down. And then all of his keratin grew back and he looks totally normal. You'd have no idea that this happened to him now. I saw him maybe 4 years ago. And yeah, doing great. And one of the reasons why we could expect or be more hopeful for normal growth and return to normal appearance is that germinal layer was not affected. So we just had to make sure things stayed clean, that he stayed comfortable, that he ate, and life is good. So he did really good. Really, and I say he, but I'm going back and forth between he and she. So here's another one. Okay, so this is an excellent case. Macy, this case is really cool because Macy and I knew each other from my time up at Medical Center for Birds, and her owner is wonderful. And then she moved down south and saw a colleague of mine, and so that she had also known from being up north. And so it's kind of neat how, although we all shifted in location, she was able to still access folks that knew Macy and whatnot. So this is the first time Macy ever had this problem, and she presented it to a colleague of mine. And the situation was she just moved, and well, when I say just, she had moved within the last 6 months, and things were crazy, and Macy didn't really have her normal setup. And she goes, I needed to just bring her in. Her beak was weird. And what we identified, go to this next photo here, is that there was all of this thick flaking, abnormal coloration, and oh my gosh, it smelled like a foot. It was so malodorous. And this happens often, right? And so what happened with Macy is that we said, all right, let's take the hat off this party. Let's fix the elongation of this naphethecaltomium. Okay, I feel like you guys should know this word now. The cutting edge of the lower bill. Let's shorten that to its appropriate length so that these sections here and here of the bill are more in contact. And let's make sure that we're not leaving any extra flakes. And ultimately, you get that keratin down to a healthy keratin level, or a healthy level, and you've essentially solved the problem. So there's no need for like medications or topical things or whatnot. Macy did great. She did great. And what we identified is that in her move, she didn't have her normal toys, her normal wood, her normal porches. Everything had changed. And she had less access to these items. And as such, the normal grooming behaviors that she would regularly engage in to maintain her beak as we had all known it over the years were no longer available. So this is like you giving somebody with really curly hair the wrong kind of brush. If you have curly hair, you know that can go real bad real fast. And so ultimately, we fixed her environment. We said, all right, let's get her back to her normal. Let's make that a priority. Saw her again in a month to make sure that there was nothing more that needed to be done. And she continued on doing great. So this was a single event that was affixed by shaping the lower bill again and improving the husbandry that she had at home. Now, this is a cool case. This is a sedated cockatoo. And I wanted to use this as an example to show how in the medical setting, we can rely on radiographs to help us safely trim birds' beaks without going too far or without taking enough. So this is this bird at presentation. She is sedated because we needed to take x-rays and we also needed to do a pretty big beak trim. So sedation was necessary for her to endure this treatment. and she did great with it. So you can see again, this nasopharyngeal is profoundly enlarged, right? She was very thin because she couldn't eat anymore. The keratin is also very, very thick. You can see this kind of ledge that kind of comes off here. And then your upper bill is also abnormal in that the tip, this rhinothecatomium, is elongated and also very, very thick, right? So what's neat is when you look at this in the X-ray, you can actually appreciate all of those things. And so you go, here's the bone of the upper beak. You see that sharp point. We know that around it is going to be a dermal layer, very lightly, that's going to carry a lot of nerves and blood vessels. Well, excuse me. But then you can see this kind of like mineral kind of structure. And this is all the keratin. So what we did in this case is we measured the amount that we needed to take off of every single area. So that way we could get the most accurate beak trim that we could at this time, but without going too far. And as you can see, the after, she looks much better. It's not perfect, but you have to be careful when you do these beak trims and you go from something that's very abnormal to something more normal, because their muscles, their everything, their whole face, they're no longer used to what normal is. So you go, let's get things to a point where they can actually prehend food. They can help groom things themselves. And then let's see you in about a month's time and do a little bit of finer work. So what you can see in this after beak shaping X-ray is that the length has significantly improved. The thickness has improved. We've given her a point, but when she came in next, we took this part down here, right? Because that's still a little bit abnormal. But ultimately, it's really neat to see how an X-ray can help from a planning perspective when it comes to these larger, more complicated types of reshaping. All right, so this is a cool one, and I'm very interested in you guys kind of creating your own thoughts about this, right? So Emily is a 34-year-old green macaw, and she's come in for just her annual. Life's good, right? Everything looks great, but she's like kind of nervous in the towel. She's doing alarm calls, and you're like, I don't really want to have you anymore. So you have her in a towel anymore. So I let her up, and you look at her beak. And the question is, does her beak need to be trimmed, right? Is there any reason why we need to touch this beak? And I hope at minimum, you guys are saying, well, maybe not, or definitely no. And the reason why I bring this up, and I want to bring you through this thought process, is because beak trims, as you can see, have a huge part. They play a huge part therapeutically for patients who have malocclusive issues. But ultimately, when there isn't an issue with malocclusion, should you be messing with the normal growth of that keratin? And here, what we're seeing is just that normal elongation from the germinal layer down to the tip. We see that there's a beautiful and normal contour of her upper bill down to that rhinothecatomium, perfect for this species. We see that her mouth is a little bit open, but upon it being closed, these two areas would would be like almost in contact. The thickness and appearance and odor of her lower bill are normal. And when you give her a treat, she crunches through it really well. She is seen at home grooming on perches and ripping through wood and toys. And ultimately, there's not a lot to be done here. She's kind of doing it herself. And what we have to do is just allow this new layer to grow out and allow her to continue to groom as she has been. And she will take care of this on her own. It's very interesting because, you know, I I went through my internship and my residency and then being in practice, and now I have a resident. And the first thing I told her is, stop immediately trimming beaks. Pause and use it as a part of your visual exam and physical exam. And ask the question, is there something abnormal with this beak? And why? And if the answer to why is because there's a lack of important husbandry items for that species, well, then shoot, give them those husbandry items and you've just enhanced their quality of life. If, on the alternative, the beak abnormalities, let's say, like in Pickle's instance, right? If those beak abnormalities are there because they feel like just crap and they're not brushing their hair, right? Well, they may not be showing that they feel awful yet, but maybe they're just brushing their hair a little bit less, they're grooming a little bit less, right? And these are small things that as bird owners, we can pick up on, and as bird caretakers, we can put in our bank of observations that can help us catch disease earlier. And the last thing any of us want is to find our bird at the bottom of the cage because we missed something. Now, sometimes acute disease happens, right? But ultimately, all of these tiny things can make a huge difference in our ability to detect disease. And if beak abnormalities are because there is an underlying disease, and you're not taking the moment to think through that potential process, and you pick a bird up and you do a big beak trim, and there's other stuff going on, the risk of that beak trim goes up profoundly. And then you hear about these horror stories where birds have passed, and you go, oh my gosh, how could I prevent that in the future? And you can see how a simple observation and answering the question, why? Why am I seeing this? And what could we do about it? Can really make a huge influence on the timing of therapeutics, the timing of any type of beak shaping procedures, the recommendations that either as a veterinarian you make for your patients, or you guys may go back to your own bird's cage and look at their beak and go, oh yeah, maybe I am going to try and give them something a little bit different to chew on and see if I can help them maintain their beaks a little bit better. But yeah, so I hope that these cases and these thought processes are helpful and give you a little bit more information and confidence in your observations. So, we just kind of went through this, and I think that, foraging and training is super cool. These activities here, this is Athena. She's a really good forager. This is a little contact case, and she's got a pine nut in it. And she's been foraging for years. So advanced things like this, are old hat to her. But ultimately, the more we can get our birds engaged in normal activities and normal use of their beak, the better. The better they're going to be able to maintain those bills. And if we're doing all of these things and we see that something's abnormal, let's get them checked out, because that's an important observation. I put Busy Beaks here. They've got some really good different multimedia and different materials that are helpful on the site. So I always like to reference that because I use it all the time. Annual exams are great, right? So this is sweet. So I put this picture of me in here. This is when I was in vet school and I had just rotated through at Medical Center for Birds before I even worked there or anything. And this was the first macaw that I bundled up in a towel, and she didn't make a peep, and just kind of laid there in my arms like a baby. And we did our exam and let her up, and it was no big deal. And so anyway, it's a special memory. And so it's on the annual exams picture and on the annual exam slide. And ultimately here, I empower every single one of my clients to know what their bird's normal muscle score is, to know what their normal, like, everyday is, to tell me if there's a change in their everyday, to evaluate their muscle score at home, to take their weight at home, to really be able to be a part of the care team. So that way we can catch things that go wrong as soon as possible. So having that extra set of eyes and learning as much as you can from your vet visits is, I think that's everything. Nutrition is important, right? So nutrition's complicated, and this could be a whole like 5-hour talk. We could talk forever about nutrition, right? In general, having a balanced diet more than anything is important. And what we know right now, based on the literature, generally, right, is that formulated pellets, fresh veggies, some nuts and seeds, at an appropriate proportion can really improve the longevity of our parrots and also reduce the risk of significant diseases, like what we saw in James with hepatolipiddosis. You worry about things like heart disease and vascular disease in birds. And we know that there is a nutritional component to that as well. And so keeping in mind at minimum about keeping your bird on a balanced diet really, really will help with longevity. And self-education, right? So coming to things like this are really great. I put this up here. Again, this is a sweet memory. So after I was at Medical Center for Birds for my externship, I got this book. And I'd been there for a month, and I thought I had learned all sorts of great things. I was like, wow, I'm about to graduate vet school in 3 months. I am going to be so much better at working with birds. I can't believe all of the great experience that I just got. And then I get this book, Birds for Dummies, from Brian. And I kind of got a little bit bummed. And I said, well, maybe I didn't learn as much as I thought because I got the dummies book, right? Well, it turns out on the flight home, I read the whole thing and I learned a whole ton more from it. So the reality is that going through resources, finding good, reliable resources, no matter how experienced you are, if you can pull one single small gem from it, it just makes you that much better. And then if you know all the things in there, well, then that's awesome because it gives you the confidence that you're doing the best that you can. And so I found this book helpful. So I wanted to put it on here in case y'all do too. So thank you so much for being here and listening to my rambling. I love being able to work with Phoenix Landing and do anything I can to support them. So I'm excited to answer some of your questions, and I hope that you found this fun and informative. And yeah, so I'm going to go back to let's see. Anne, should I just stop sharing my screen? What would you prefer?
It's totally up to you.
Okay.
You have a favorite slide that they can see more of instead of us? Yeah.
But let's see. Oh, well,
we have a question about that, about the cockatoos. So that would be a good one for.
We can go back to that. Sure.
Yeah. Well, first of all, before I forget, I know we have some IAABC members here today. That's the behavior consultants. Your secret word is keratin. So email us and we'll send you the code for your CEUs. And first of all, absolutely. Thank you, Dr. Murphy. Packed full of information. And just a personal thank you for stressing how important it is to not trim a bird's beak when they don't need it. I mean, that for those of us who've had birds a really long time, that was considered the norm. And we encounter that all the time. And we always say, why? Why should you do that? It's full of nerve endings, as we now know from all these wonderful Scott Eccles images. Yeah. So, okay. So a couple of questions about from Ron specifically, and one of them is about this. He says, in the cockatoo's thickened beak, how does the excessive buildup of keratin affect the natural ridges, and especially when it's thinned and removed?
That's an excellent question. And, those ridges pretty much go away. Like it grows and it gets thick. All of the normal contour of the keratin that we appreciate in a normal bird is no longer visible. It makes it very challenging to do these types of trims because there are so many different types of tiny details that you have to be aware of. One of the really cool things that happens though is once you're able to generally get their occlusion back to normal, they become a part of the team. And that's one of the big things that we did for this cockatoo, is that maybe here, well, not even maybe, we know that there's still more work to be done. But how much work is on us versus how much work can this bird do on their own now? And really, they will do a ton of their work once they can. So ultimately, we expect it to be much different. Or, you know, we didn't have to do an X-ray the second time because we knew what we were dealing with. But we didn't have to shave this down a whole lot. She had done a lot of good work already. And so I think that some of those natural contours are not necessarily our job to fix. It's our job to give them the ability to recreate it on their own. I hope that that makes sense. Please let me know if you have any other follow-up questions about
Are
that.
there things that you can give a bird, you know, like more wood toys, whatever, things that you recommend are especially helpful for helping them help themselves?
It's a great question. It so depends on the individual.
And the species, probably.
And species, yes. So, I mean, I know macaws well, right? That I have one. That's just what I think we all have our favorite species, right? So yeah. Oh, there you go.
Of course, green wings. Yeah.
But I do love them all. So the point of this is that let's take my bird Ava, for instance. She likes balsa. I'm like, girl, you could do more than balsa. But she's like, no, I'm a princess. I'm going to do balsa only. She likes it in these, you know, rectangular shapes that are only about yay thick. Any thinner, sometimes she goes around with it. Any thicker, she's not interested. So for her, when I'm making toys or buying toys for her, I'll look for toys that have those general components overall. But then I'll have some thicker and thinner things in there too, which when she really gets going, she'll dig into. But I had to go and give her all sorts of different things she could have in her foot, like little wood balls or, you know, stuff hanging down. That's like longer and bigger. And I had to watch and see what she interacted with the most to figure out what was right for her. Now, if you look at some other guys, you can just throw like a 2x4 in the aviary and they just rip it to shreds, you know, and they're not going to want to mess with Princess Ava's, you know, little squares, little rectangles.
Yeah, balsa for a macaw is not very, it doesn't take a lot of work. Yeah.
Exactly. So one of the really cool things though that I've seen and done across the board is, you know, you get an untreated piece of wood and you can drill some holes like maybe halfway deep into it, and you can put your bird's favorite treat into those holes, right? And you don't offer the treat anywhere else. So what happens is they'll go in and they'll dig into it, and they take their upper bill and they dig into that hole to try and get it. And it acts as like an emery board and helps really keep that point nice and sharp. And it also keeps like all of that flaking keratin that likes to happen around that area. It keeps it nice and smooth. So, you know, those are fun things, but really you just got to figure out what your bird specifically likes.
I mean, technically birds are supposed to have sharp beaks. That's why they're hook bills, right? But I think people got in the habit of trimming them because they didn't want to have a bite that hurt so much. But you know,
what do you know, it's so funny. I've had some clients come in and ask me that, and I go, okay, when you get bit by the bird, what's the worst part? Is it the piercing part or is it the pressure? And they go, oh, the pressure. And I'm like, yeah, they can pierce you, but it's the pressure in which that pierces. And I'm like, there's nothing we can do about the pressure. And so that kind of helps, you know, explain that that blunting isn't going to do a whole lot. But yeah, it's funny. You talk about it, growing up in the field and growing up with birds, the annual beak trim, blunting, these are all things that like
Yeah.
we kind of grew up with. And it was so interesting to obtain a new perspective and a more powerful one. And I was like, once I did, I was like, oh yeah, my mind's changed.
Especially science now with all the images and realizing that it hurts, it can really hurt
Absolutely.
them. Yeah.
Mhm.
So yeah, maybe people need to understand behavior better and avoid bites rather than trying to prevent the beak from being piercing, right? So I know Rosemary Lowe always, who's one of our favorite, she's very well known for all her books and her conservation studies, etc. She says, all the birds need fresh browse and wood. I mean, because in the wild they're eating. That's how they're managing their beaks a lot. So natural wood is very helpful too, I think. Yeah. Ron, someone to know what you said was the best avian opioid again?
Oh yeah. Okay, this is actually a really cool topic. So in birds, we know that they are of the avian, right? Not the mammal. So when we use an opioid, the purpose and the reason why that drug works is because there are opioid receptors or specific receptors within the brain. In mammals, we have a predominance of mu receptors, in which case your mu-based opioids are going to work the best. Things like morphine, hydromorphone, buprenorphine, these are all mu opioids. However, in birds, the shift, so everybody has, different receptors. So the mu receptors are what's prevalent in mammals, but they have kappa receptors at a lower concentration. In birds, it's switched. Birds have a higher concentration of kappa receptors, and they have a lower concentration of mu receptors. As such, your kappa-based medications like butorphanol are the best to relieve pain. In cetaceans, if you look at birds of prey, they're a little bit different. So if you're looking this up and you're saying, well, gosh, wait a minute, why are they talking about a mu opioid rather than a kappa in birds of prey? Well, then they're a little bit different. But there's a great paper that describes this, some research they did in pigeons. And so it makes a huge difference using the right type of medication based on the receptors you have in your brain. Now, what's further interesting is the use of tramadol. And tramadol is a synthetic opioid that there is a baseline of understanding of how it works, but the true full, we don't know everything, right? In humans, medicine is a gray area at all times, right? So tramadol is interesting because technically it shouldn't work in birds because it does lean more to a mu type opioid, but the synthetic nature of it does something, and it's interesting too because, you have a bird who you've maintained on butorphanol in the hospital. Let's say they broke their leg and they're eating, they're drinking, they're grooming, they're doing everything great. You've got their leg all fixed up and whatnot. And if you take them off the butorphanol and have them on nothing, they become depressed and clearly painful. If you transition them from butorphanol to tramadol, they maintain their comfort. So we know it's doing something. We just don't know all the details on how it got there. So I hope, sorry, I know that was kind of like a high level explanation, but I hope that was the information you guys were looking for.
Do you think that's where does meloxicam fit in that pain relief? I mean, some veterinarians say they don't think it's very effective, and others are like prescribing it all the time.
Yeah. So meloxicam is a different class of drug. It's a non-steroidal anti-inflammatory drug, or an NSAID. And this is in the same line of drugs as like your ibuprofens, your naproxens. Those carprofen is something that we see in the like bird or the chicken and duck. We use that a lot in chickens and ducks, and of course in the small animal world, right? So they are all the same class of drug and work generally by the same mechanism, where they work as an anti-inflammatory specifically, rather than dulling a noxious stimulus causing pain. So, you know, like you get a headache and it's throbbing, and you take a ibuprofen and it feels better. It's that dull, inflammatory, throbbing pain that is controlled best by anti-inflammatories. Whereas you break your leg, well, there's inflammation involved in that too, but there's that noxious stimulus as well.
Right.
So pain management is very interesting because the dose and frequency at which it is provided, and also the recognition of the type of pain that you're treating, are all variables that either will make you successful in pain management or make you unsuccessful. So if you have a pinched nerve and you give tramadol, it's not going to do as well as if you gave gabapentin, because gabapentin treats
For the
neuropathic
nerves.
pain. Exactly, yeah, neurogenic pain. And so understanding what type of pain could be present and then tailoring what you choose to do is very important. Also, environment is important too. You know, I'm gonna be a lot more pain with a broken leg on a perch than I will in a box until that leg is healed, right?
Right. Absolutely.
And then, you know, with meloxicam specifically, over the past, let's say 15 years, there's been a lot of research in meloxicam dosing. It used to be that we were giving doses of somewhere between 0.25 to 0.5 milligrams per kilogram in citizens, because again, there's going to be different dosing based on the different groups of parrots or groups of birds. But there are a lot of papers that have come out in the past 15 years that have taught us that the injectable dose of meloxicam has to be at a certain point. Otherwise, it's non-therapeutic. It does nothing, right? The oral dose has to be higher than the injectable dose because the bioavailability of that drug, when it's broken down and absorbed from the stomach into the bloodstream, you got to give a little bit extra because you're not going to absorb all of it, right?
And they're so efficient. I mean,
exactly.
yeah.
So all of these little things play a part in your pain control success, right? And oh my gosh, that's like a whole nother thing, which I'm also very passionate about. As you can tell, I could really go forever. So
About pain meds, yeah. Yeah.
Awesome.
Well, I figured you were talking about the opioids and tramadol. I assume they have to kind of wean down after that to something else, right? Like meloxicam or something. You can't just go cold turkey, probably.
Well, actually, what's interesting is we usually, so when you're applying when you're creating an analgesia plan or a pain management plan, right? You can select to use a single drug, and you can go up and down the dosing scale of that single drug, right? But most of the time when you have pain, there are two or more components to that pain, right? An inflammatory or neurogenic. Or like, for instance, if the broken leg, you're going to have inflammatory components and you're going to have a noxious stimulus. Mm-hmm. And so we use bimodal 2 medications or trimodal 3 medications, all at a lower dose. So you're like, oh, that's kind of cool. I don't have to like max my dose out and potentially succumb to side effects of a high dose. I can use the lowest effective dose of 2 or 3 medications, treating pain from all different angles, working in concert. And then you go from that 3, things are starting to heal, you're starting to feel better. You drop the opioid first, because that's the first type of pain that's going to go away. Then maybe if you're doing a trimodal approach with gabapentin as well, you drop the gabapentin and you're just on the anti-inflammatory for a little bit. But ultimately, every time you stop, you get good control. And then every time you think things are getting better, you stop that medication, you titrate it down, and you go, how you doing, kid? Was this okay? And you go from there. So that has been the most effective approach to pain management, really giving that I have created, I guess, in my practice. And I always hope for more options, right? But yeah, one thing that's really cool is that, you know, we always worry in cats and dogs about the use of non-steroidal anti-inflammatories and liver issues and kidney issues and whatnot, right? Mm-hmm. And in birds, because they have that mammalian, reptilian mixed kidney, right? they don't appear to come to the same level of effects that mammals do.
Hmm.
And so I've had birds, older birds with arthritis on 1.6 mg per kg of meloxicam for twice a day for many, many years, 7, 8, 9 years. Kidneys are fine. They're doing great. They're a little crotchety here, but life's good. So, you just have to look at the patient in front of you and make your decisions for that individual based on the wealth of general knowledge that you have, right? So anyway, I hope that helps explain kind of the basis of pain
So
management.
like this cockatoo that's on the screen, I mean,
Mhm.
instead of slowly taking it back and trying not to get into the nerves too much, it's probably better to go a long way, give it pain meds, and then and just be done with it, right? So, but a lot of birds probably they need just a little shaping to get it back in order. Or especially, I know a lot of birds who have a problem, a malocclusion on the inside of the upper beak, so the bottom is not fitting properly. And
100%.
I'm not sure there are a lot. I don't hear a lot of veterinarians necessarily talking about that. When I think sometimes we need to address that more.
Absolutely. That specific piece of anatomy in the upper bill that you're referring to is something we call the occlusal ledge. And that occlusal ledge is not present in every single species of parrot. It's mostly present in macaws, but then people will translate macaw to a hyacinth, completely different species, R versus Anatorhynchus, right? So, we expect their physiology to be a little bit different. So knowing the species normal when you're making these changes is really powerful. And knowing, hey, do I need to shape an occlusal ledge in there or not? But I try and get the word out. You try and get the word out.
It's just like one of those little anatomy things that's like the next level, but not,
Exactly.
not always the basics. Phoenix, my green wing, will actually open a quick link and rub it back and forth on the upper beak to trim it inside, which I think is so cool. Yeah.
It's how they use these different tools. And again, it's like Princess Ava wouldn't do that, right? But that's the difference between what Phoenix needs versus Ava needs and how the individual can really benefit from understanding their specific needs. So, well, these are such good questions. I have about maybe 10 more minutes.
Okay. To be clear about cockatoos, because I think a lot of people don't understand how different they are. Their little points are the beak is supposed to be between those 2 points. And if that starts to move at all, go see your veterinarian right away. Because it can get all like what's the word? Or whatever. Get malaligned very quickly. Yeah.
I think that's a really good point. If you're starting to see some changes in the keratin of the bill like that, address it early before it's this sweetheart who's going to do fine, going to do great, right? But I mean, these owners, they just didn't know. Now they do. They'll make different decisions. But even if
you should go home with every cockatoo, make sure your little points are in the right place. Yeah.
Yep.
Do you notice that cockatiels, based on age or health, have darker feet, darker beaks, whatever? There's a couple of cockatiel folks here.
I think there's so many different.
Not something I've ever really specifically noticed.
Oh, excuse me. Ava has an opinion right now.
How old is Ava?
Oh,
she's young, huh?
She's 10.
Yeah. In puberty.
Yeah, yes, she is.
So as a bird ages, do they get more keratin layers, and does the color change?
I mean, maybe they do. If there, I can say that some of the changes from when Ava was a young little baby up until now, her beak has changed. There's the wider portions are now darker and less pronounced. The darkness of her beak is more pronounced, but none of it strikes me as abnormal because it seems like it's just an individual variation that I see in a lot of different patients. I think that just how you can have black toenails and white toenails, and it can all be the same color, color mutation, cockatiel. It just, I think it's just going to vary. I don't see any, I can think of any reason why I would be like, oh man, that just went from like, white to black, we're in big trouble, as long as everything else about the bird looks okay, so I think it's like,
It's more about the
interpreting.
keratin layers, maybe, huh? I mean, some layers are okay. I mean, people get really worried when they see it's not perfectly smooth, or part of the beak trims to get it buffed and polished. But it's normal to have some of those layers, right?
So yes, it is very normal to have some of those layers. And if you're seeing that they're getting worse, like let's say your beak had another tongue tie, right? Let's say your bird's beak has been a certain way for many years, and now you're seeing, oh, it's more flaky. Why? Are they not choosing to groom like they should? Because they're not feeling good? In older cockatiels, maybe they have arthritis and they can't get to their toy or interact with their toy the same way.
Right.
Or
It's
maybe
not the beak, it's other issues, just like you
no,
started and finished with, right?
maybe their favorite toy was removed from the cage because we thought it was too old, right? I do that all the time. And they're like,
How
no.
dare you? Yeah.
Yeah, so I think you just have to like pause, say, I'm seeing a change. Why am I seeing it? Could there be underlying disease, or is there a husbandry thing that I can adjust and go from there?
That's a good answer. Somebody wants to know, is beak rot a real thing?
Beak what?
Beak rot, R-O-T?
Oh, beak rot. Well, I'm not familiar with what that terminology, like what specific disease that terminology refers to. However, you can absolutely get a multitude of infections of the beak, and it can be very devastating. I have a case now that we're working on. Not really sure exactly what's going on with this beak yet. Actually, we're going to biopsy it. But you look at it, maybe I would say looks kind of like a beak rot situation, but I'm predicting that we're going to find a very deep-seated infection in the dermal layer of this bird, and it's just pulling the keratin off. The person who asked it, if there's a specific disease process that refers to that I'm just not aware of, maybe I could answer the question more specifically, but
can there be cancer of the beaks?
oh yeah,
Oh,
absolutely.
interesting.
Yeah, so you can have squamous cell carcinomas. That's the most common, and that's kind of a tough cancer because you'll see the mass wherever it is, but then the tendrils, they eke out in all these different directions. And so even if you could remove that mass, the cancer has spread in the underlying tissue. You could only remove so much, you know what I mean? Or not at all. In which case radiation sometimes can help depending on the location, but radiation is intense as itself. So cancers of the beak can be very devastating.
Are there foods that really promote good keratin, not only for beaks, but for feather sheaths and all the other keratin related things of a bird? Are there certain vitamins or foods, B12 or whatever?
Yeah, I don't think that there's one single vitamin or two single vitamins that I would say, oh my gosh, if you get this, you're going to have the best. You can have the best beak, right? I think the most important thing in maintaining beak health is maintaining a healthy body weight and also having a balanced diet, right? And those two things go hand in hand, because with that balanced diet, you're going to be able to get all of the nutrition, all the nutrients that you need at the right concentrations. And that's going to just reflect, I mean, just like in us, like if you have scurvy, your nails are going to get funky, right?
Right.
The bird has scurvy, it's just essentially a big face nail, right?
Variety.
So,
Yeah.
balanced diet, healthy body weight, avoiding over conditioning. I think if you honestly, if you only did one thing for your bird, a balanced diet would probably be the most powerful thing you could do. Because it helps you avoid so many diseases that it's
Right.
just worth it.
Doesn't keratin require a lot of extra protein? Like when a bird is molting and regrowing feathers, don't they need a little extra protein?
Yeah, yeah. So when you think about the energy needs at different life stages, molting is a super energy expensive life stage, right? Because your body is like literally like like it's losing all of its feathers and then regrowing all of that, right?
Mhm.
Molting is a super intense, it's very calorie expensive. Reproduction is calorie expensive. Disease is calorie expensive, right? So I think that if you have a good foundation, right? When you need to take a withdrawal from the bank, that withdrawal doesn't hit the balance as hard, right? And molting, it's not gonna empty your bank account if you have a good
If you
foundation.
already have a good diet, right?
Yeah. Now, if you're molting and you're breeding and you're doing all these different things and maybe you're a little bit sick, well then yeah, your nutritional plan is gonna have to change no matter what, right? But if it's just these natural ebbs and flows throughout your like year, if you have a good foundation, you should be able to handle it well.
Isn't
So
that what Harrison's high potency is recommended for times like that when you need a little extra?
yeah, so the Harrison's high potency is used in two different main events. If you have a bird who's previously on a seed diet, right, all seed, and you logically know that there are deficiencies present, rather than going, well, I'm going to create this balanced diet and then I'm going to supplement it with extra stuff to relieve those deficiencies, the high potency kind of does that for you.
Mhm.
So there are some birds, for instance, like let's say birds who are super active, like if they're flying all around,
Beaks.
yeah, yeah. I mean, there are times where if you have a breeding pair, you
Mm.
want that supplement, that extra all the time, right? Whereas if you're just, you know, hanging out with mom, watching TV, doing a little bit of stuff, whatever it is, um, you don't need all those extra things. So you really, and I keep saying this, it's like behavior you have to tailor, uh, nutrition you have to tailor, environment, it's all based on the individual. What do I know globally? And now taking that global knowledge, what does this individual benefit from? So whether it's high potency during molting for a little bit, that's fine, you know. What I see in practice is that if you have a good foundation, if you molt, you'll be fine. But you got to have a good foundation.
Yeah. Yeah.
Yeah.
And maintain it. Yeah. One last thing. So back to beak rot again, she specified it's the bacterial infection that's between the layers of keratin. And I guess, yeah, how do you know that there's a bacterial infection in there, first
Oh,
of
it
all?
smells. It
Huh?
smells like it smells like
Oh, the smell is the first indication.
yeah, yeah. And what's cool is if you catch it at a relatively early stage, moderate to early, you can just Dremel the outer layer of the keratin off.
So the air, and it's an
Into air.
anaerobic
Yeah, and it just
infection,
dies.
basically. Oh,
You
so
know,
the
it's
air
just
will clear it. Yeah.
yeah, yeah.
But it's
It,
what kind of a bacteria is it usually in the beaks? It's not the same as a digestive tract like Clostridium. It's probably something more.
you know, I've never had to culture it because it's always
Ah,
gone away. I'm like,
huh.
oh, this is nice.
So what kind of antibiotic or you do antibiotic? You try to let the air take care of
I
it.
just, I shape the beak. I take, it's funny. My mentor would say, you got to take the hat off the party or the roof off the party. That's what it was. Take the roof off the party and then the party will dissipate. And it's the truth. It becomes more challenging in a completely different thought process when that infection has now gone deeper into the under layers of the keratin. Then you're getting a chunk of tissue, you're biopsying, you're culturing, you're doing those different things. And there's all you can, I mean, it's any bacteria that just decides to be invasive. It can be staph, it can be E. coli, Pseudomonas, you name it. If it
Yeah.
finds a home it likes, it'll grow there, right? Sometimes you do one shaping, you take the roof off the party, it gets 85% better. You see them again in a month, you finish the work, they're good, right? So sometimes it does have to be staged, but ultimately, it's very effective.
Some of us may not get that close to smell it, there might
Oh,
be
you
like
smell
a
it.
bonded pair or something we don't want to come between. Eventually that bacteria will show itself.
It makes it flaky. I mean, you don't have to get close to smell it. I can walk into an exam room and
Oh,
I
it's
smell
that bad.
and I look at the bird's face and I go, we got a little work to do, but you'll be fine. So it really is quite pronounced.
Okay, very interesting. I hope to never encounter that, at least
I
in my
hope
own.
you don't mind.
It sounds nasty.
It's
So you
tasty.
can't put like some chlorhexidine on it or something, and
No, it's not going to do
no,
it.
let
Yeah.
the air take care of it. Well, that makes sense. Yeah. All
Well,
right. Well,
if there are any other questions, like I said, what I'd like to do is just anything that's in the Q&A, if you send me an email with those questions, I will type answers and we can disseminate that to all the attendees so they can get their questions answered. But I do have to go if
yes.
that is okay.
And we are so grateful for your extraordinary time. And I look forward to seeing you in person at the conference in a few weeks. Yeah. And this will be so valuable to people for a long time to come. So thank you for making that possible yet again.
Oh, absolutely. Absolutely. It's my pleasure. And I look forward to the next time. Thank you, everyone.
Good. We'll plan another one in 2025. I can't believe we're saying 2025 already, but okay. All right, we'll work on that. Thank you, Dr. Murphy. You're the best.
I'll see you guys later.
Bye, everybody. Thank you for coming today.